Russell went to their local pharmacy to check his blood pressure. The result was 140/95. What does this mean? As blood circulates through your body, it exerts pressure against the walls of your arteries. That pressure is what's measured with a blood pressure device. Blood pressure is measured by two numbers: systolic, or the top number, or the first number, and diastolic, the bottom or the second number. Systolic measures the pressure in your arteries when your heart is pumping. Diastolic measures the pressure in your arteries when they're resting and refilling. High blood pressure is something you need to avoid in order to keep your heart and arteries healthy and clear of any cardiovascular disease.
So let's start with the basics. How do you properly measure blood pressure at home?
Great question, Anthony. Blood pressure is always best measured at rest. It's important to take your blood pressure following these easy instructions. Sit comfortably in a chair that offers good back support, much like the one that I'm in now, and uncross your legs. Place the proper size blood pressure cuff on one of your arms. The cuff should fit snugly around your arm. You should be able to fit 2 fingers inside the cuff after it's been placed on your arm, and the bottom of the cuff should be 3 centimeters above your elbow. It's important to note that there are several sizes of blood pressure cuffs. So if your arm is slightly larger, you can get a bigger cuff. And if your arm is smaller, you can get a smaller size cuff. So if the blood pressure cuff does not fit properly, make sure you go see your physician or another healthcare provider to make sure that you're taking your blood pressure with the right size cuff. Put your arm on the armrest so that your blood pressure cuff is at the same level as your heart, roughly around here. And relax for 5 minutes and do not talk. If you have time, take your blood pressure 3 times over that 5-minute period and discard the first reading and average out the second and third readings. Keep a log of your readings for your doctor.
Are there any particular times of day or eating, drinking activities that you should avoid before taking your blood pressure?
It's good to take your blood pressure actually at various times throughout the day. And the more readings you can take, and average them out, the more accurate your blood pressure readings will be overall. Generally, it's good to take your blood pressure before meals. Avoiding significant amounts of caffeine or alcohol intake are also good, as both of those substances can increase your blood pressure. Avoiding vigorous activity or exercise before taking your blood pressure is also advised. It's good to have you in a low stress environment as well. So if you're very stressed or anxious about something, that can artificially increase your blood pressure. And so taking it when you're more relaxed is advised.
Where would I actually get a machine or a device to measure my blood pressure?
The most common place that people get them would be a pharmacy. There's usually multiple brands that are available. And obviously, picking up a blood pressure cuff that is Health Canada approved or FDA approved is important. There are automated cuffs now that can cycle on a regular basis and help you average out your blood pressure in an easier fashion. And then there are more complex apps now where you can actually follow your blood pressure on your smartphone or on various other devices and log into a portal. So there's lots of different options for people depending on how high tech or low tech. Even writing your blood pressure readings down in a journal so that you can take those to your doctor is helpful as well. So as long as you have the right size cuff and you've got a device, there are many options for you.
So is there an ideal blood pressure?
There are ideal numbers to target for blood pressure. There are many different organizations that publish cutoffs on what the numbers should be, but I find the simplest to follow are the American College of Cardiology and the American Heart Association's joint guidelines. A normal blood pressure is below 120 systolic and 80 diastolic. You're classified as having elevated blood pressure if your systolic is between 120 and 129, and your diastolic blood pressure is less than 80. High blood pressure or hypertension is classified as stage 1 if your systolic is 130 to 139 and your diastolic is 80 to 89 in stage 2 if your systolic is greater than 140 and your diastolic is greater than 90. It's important to note that the reason there are these different stages is that as your blood pressure increases, both your systolic and diastolic, your risk for having adverse events such as a stroke or heart attack increases. So the lower the stage or even normalizing your blood pressure will provide benefit in decreasing your risk for these poor health outcomes. You should note that if there's a disparity in the category between the systolic and diastolic pressures, the higher value determines the stage. And other things to consider are that if your systolic blood pressure is classified as being hypertensive and your diastolic blood pressure is within normal limits, you can have isolated systolic hypertension. And the reverse is true also. You can have isolated diastolic hypertension.
So why is it important to measure the blood pressure at home? And is it relatively accurate if I do measure it at home?
Absolutely. It's the most accurate when you measure your blood pressure at home. The reason being, when you go into a doctor's office, you can have feelings of anxiety and stress, and so that can increase your blood pressure. So there's something called white coat hypertension, where people will go into a doctor's office and measure their blood pressure, and it's elevated. But if you were to measure it at home, then it's actually normal because their stress levels that their body sees on a day-to-day basis are lower. So you wouldn't want to go into your doctor's office, get diagnosed with high blood pressure, be started on medications that you don't need, and then when you go home, your blood pressure is actually low. And the reverse can be true also. So when people go into their doctor's office, their blood pressure may be normal. And when they go home, their blood pressure is elevated. And that's called masked hypertension. So for both of those reasons, and for having your stress levels be reflective of what they are on a day-to-day basis, it's more accurate to measure your blood pressure at home. The most accurate way to measure someone's blood pressure is by using ambulatory blood pressure monitoring, where people will wear a blood pressure cuff over a 24-hour period or 48-hour period. And that blood pressure cuff will cycle on a regular basis. And then you can be provided with daytime average blood pressure readings, nighttime average blood pressure readings. And so there are slightly different cutoffs that your physician would interpret to diagnose hypertension in that case. So it's great to have these different non-office-based blood pressure management, blood pressure measuring solutions to make sure that you're getting the most accurate blood pressure reading you possibly can.
So why is it so important to maintain an ideal blood pressure?
Well, if you think about your heart as a muscle, then you can see that your heart would be working out against or pushing hard against this higher pressure over periods of time. And as that muscle is getting worked out, the size of it increases and can actually impair filling, and the walls become stiff in that muscle. The other thing is that the muscle can become weak over time, and so that can result in heart failure. The other thing that the high blood pressure impacts is the blood vessels in your body. So when there's high pressure beating against your arteries on a regular basis, it causes atherosclerosis, which is the collection of cholesterol and other kind of inflammatory cells and thickening of your arteries. And when that happens, strokes can happen, heart attacks can happen if those plaques rupture and clots form. Damage to your kidneys as they're trying to filter your blood can happen, and people can have chronic kidney disease and peripheral vascular disease, as well as eye problems. So there's a whole host of bad outcomes with respect to high blood pressure if it's not managed at a lower level over time.
I guess this is often why people talk about hypertension being kind of a silent disease, because when you just have elevated blood pressure, you may not notice any signs or symptoms unless it's extreme. But even if it's elevated and you're not experiencing anything, it may be causing some damage to your blood vessels and to some of those other organs that eventually do result in serious health conditions.
Absolutely. And the problems are manifest usually over longer periods of time. So it's really challenging to motivate some people as well because they don't feel like something's wrong. And unless they understand the risks to, their heart or let's say their brain and the risk of developing dementia, it's hard for them to alter their lifestyle because there doesn't seem to be any immediate threat to them.
So are there any people who might be at increased risk for developing high blood pressure?
Absolutely. So the risk of blood pressure increases as you age. So if you're older than age 65, about 50% of people have high blood pressure. If you have relatives that have high blood pressure, because it's thought to have a significant genetic component. If you are Black or of African descent, of South Asian descent, or First Nations heritage, where high blood pressure is more common. And if you are a male or female past menopause, men are more likely to develop high blood pressure than women, but the risk for women increases after menopause.
What are some of the main causes of high blood pressure?
There are two main causes or types of high blood pressure. So there's primary, which is also known as essential. It is usually the common age-related one that we see. In this case, there is no easily identifiable cause for the high blood pressure, and we don't understand the pathophysiology in general. So there's some genetic or environmental exposures which over the course of someone's life result in them having high blood pressure. There are a number of lifestyle factors that can increase the risk of having essential hypertension, including having too much salt in your diet, drinking alcohol excessively, being overweight, getting insufficient exercise or being sedentary, and experiencing unmanageable stress.
Those are the primary causes or essential hypertension. What are some of the other potential causes?
So the other causes are known as secondary when there is an identifiable cause for the high blood pressure. Some of these include chronic kidney disease. So you're not able to get rid of some of the sodium that's circulating in your blood. Hormone disorders such as thyroid problems or adrenal gland problems. Some drugs such as the oral contraceptive pill or non-steroidal anti-inflammatory drugs. These include things like Advil and sleep apnea. There's a really exhaustive list of these secondary problems, and there are reasons why your doctor might suspect you have a secondary cause. And if that's the case, generally you will have to undergo different sets of tests to come up with a firm diagnosis.
Russell went to the local pharmacy and used the machine to check their blood pressure. The result was 140/95. After 2 weeks of taking their blood pressure at home with similar readings, they decided to make an appointment with their family physician to discuss the next steps. Their doctor diagnosed them with hypertension and suggested that they first attempt to make some lifestyle changes before they consider the need for medications.